Hi, my name is Irene Chen, and I'm here to present to you the findings of whether or not SMHC qualifies for the Meaningful Use Program. We will evaluate practice level performance compared to required target values for 5 quality measures for the period between 2016 and 2017. So in short, for Southern Maine Healthcare to qualify, these are the following measures that must be met: eye exam, fall risk screenings, the flu vaccine, LDL check, and mammogram exams for ages 40 through 69. These targets must be met in order for SMHC providers and their practices to receive reimbursement from Medicare and Medicaid. This is prepared for SMHC stakeholders with a purpose to help drive improvement for practices. And there are many practices that seem to need serious improvement, while the new Stage 3 coming up will equal in penalties. Here are the findings. For the screening of fall risks for individuals, with a target rate of 22.8%, it really only looks like Aroostook, Cumberland, and Knox are the ones taking charge, while the smaller numbers are not being met by practices such as Lincoln, Oxford, and Sagadahoc. And this is crucial because while you are seeing patients, you do not want to risk them enduring a longer stay than needed, so fall risk is very important to meet this requirement. A simple eye exam, which you would think that people come in once a year for a routine, only has a target rate of 60% required from meaningful use, but unfortunately other practices do seem to fall short. We do seem to have Knox, Cumberland, and Aroostook again seeming to be the ones that exceed the target rate, while the other clinics have a lot of work to do. The flu vaccine. This is now required by CDC as well, and with a target rate of 65%. As you can see, there are clinics and other clinics not included in this because their numbers were too small that need a lot of work. Definitely seems like Aroostook, Cumberland, and Knox take charge and lead the way in meeting these requirements. The LDL check. You can definitely see some outliers here with Cumberland, Knox, Aroostook meeting the targets, while these smaller clinics again fall short. And for the mammogram exams, the different colors represent the different clinics. And with Cumberland being the orange, again leading the way, and Franklin, a lot of these kind of stay at the same level and are not meeting the target rate of 85 for sure. It definitely seems like the clinics such as Hancock, Sagadahoc, Franklin need a lot of work, especially when it comes to the mammogram screenings for ages 40 through 69. If you're able to perform them at an earlier stage, you can help prevent health issues such as breast cancer. So these are the 5 different findings where we can see that it seems only a handful of clinics seem to meet these meaningful use requirements. Knox, Cumberland, Aroostook definitely are doing a wonderful job and could be a practice for others to look at to see how they're meeting these target rates, because the others, if they do not shape up, will require a penalty. Thank you.